care system. Latest figures show a third of Northern Ireland's population are on some kind of waiting list for treatment. It is the worst in the UK, and it is putting many lives on hold and at risk, as our health editor Emily Morgan reports.
The waiting list is 3 years. We prayed a lot and we asked for a lot of friends to pray.
It is a sad state of affairs when a mother has to resort to praying for her daughter. Naomi has scoliosis, a curved spine, and needs an operation. She's 14, growing and in pain, but waiting lists in Northern Ireland are so long that her family are now crowdfunding for surgery in Turkey.
When you're seeing your daughter every other day with painkillers and her not being able to get out of bed and being aching and sore, it's heartbreaking. I just want her to have the decent childhood that she deserves.
Northern Ireland has the worst hospital waiting times in the UK. More than 500,000 people are on some sort of waiting list. That's a third of the population. At the end of March this year, 57% of patients hadn't been seen for their first appointment in more than a year, and 61% who needed general surgery were also waiting longer than a year.
This is the actual area of the tumour.
Cancer specialist Dr. McAleer has never been more worried. Suspected cancer patients waiting for a diagnosis don't have time on their side.
How much it grows will depend from one cancer to another, but they'll come back to the system. They'll come in with more advanced disease, more difficult to treat, more difficult to cure, and needing more surgery, more radiotherapy, even more chemotherapy.
Some patients are having to wait up to 7 years for routine treatment. The man in charge told me that is shameful, but his hands are tied without more money from the executive.
I believe in the National Health Service for what it should be. That's free at the point of use, free at the point of delivery. I can't offer that here in Northern Ireland at this minute in time. We are seeing people having to crowdfund, actually having to pay for private procedures because the National Health Service cannot deliver.
It's your responsibility to offer that.
It is, and that's what we're trying to do, but I have to do it within the scope, with the resources that I currently have.
Unless those resources change, he says it'll take 10 years to clear the backlog. There's no doubt healthcare here is in crisis. The question is anyone listening? Emily Morgan, ITV News in Belfast.
Now tackling that.